Here we meet again. And I get to talk to you about real fun things, like pain. Oh, God, I must be the expert on it. And mainly, I want to talk to you that for God's sake, stop having it already so you don't wear out poor Dr. P. He comes here to have fun teaching you anatomy, and then he has to spend half his life getting rid of your pain. And you've got to learn to stop it already. Anyway, pain really is without pain, humanity would have been long destroyed. I can guarantee it, because the pain is really a priceless gift. Nobody wants it really, but it's actually nature's early warning system so that it helps you survive. Because if you wouldn't have the feelings in the areas of the body that you in some way injure or threaten your survival, you just proceed going on like there's diseases, some illnesses for like leprosy or things that where you lose feeling in your limbs, you pretty soon destroy all of them. And infections set in and you're dead before you know it. So nature has wisely provided you with millions of pain receptors all throughout the body. And the brain is constantly monitoring information from the limbs, the skin, the joints from all over the body, because the nervous system is at all times aware of where your limbs are. It's proprioception. And the signals that the nervous system receives then usually happens in 3 stages. First, you have the pain signal. Some area is in some way threatened. Imagine you're touching something sharp or something hot. Or in yoga, you suddenly are pushing against some nerve somewhere in the body that tells you, hey, watch out, that's not exactly where you want to be. And so the spinal cord and the base of the brain acts like a spinal gate and interpret what the signal tells, and your understanding previous experience with that kind of feeling. A child who has never had touched anything hot has to learn, and that'll be a very shocking experience, touching something hot. But now as an adult, especially as we learn to feed ourselves and cook, and they're very often hot pots or things that we pick up. The first time we did it probably was very shocking, and then we learn to tolerate a certain degree of that discomfort that goes with touching a hot object. So it's your knowledge, your experience of the kind of feeling that the message that they're receiving, it depends on what your response is going to be. The obvious one is that, of course, if it's threatening, you immediately stop it and correct your behavior, and that especially applies for your yoga practice, what we're talking about here. Basically, the reason we're talking about pain is because of your yoga practice. Now, the reflex, of course, reacts first. That's the thing that makes you pull the hand away or stop, jerk you, away from the object that is threatening you. And you can harness, the impulse, the reflexes, through the knowledge that you have about what's happening to you. So everything that happens, basically, ultimately, the brain has to respond of what's going on. So the pain is felt in a certain part of the body, but the response from the brain is really what determines how you react to it. Now, for instance, if you break a leg, the pain is in the leg, but what does the doctor do? It gives you morphine, which stops the impulses going to the brain, and the pain stops. Now, pain also is an intensely subjective phenomenon. People react very differently to the same kind of impulse to the body or attack to the body. Some people have very high pain tolerance levels, and other people have very, sensitive and very responsive. And what takes place in the mind is almost the most important aspect of pain. You can keep the pain as in a proper place, which is basically should be your servant, should be something that helps you to survive as you live your life through there are always various assaults on the body. But then other people become actually the victim. They become very subject to, poor me kind of attitude. You have to learn to deal with things, and that's, pain is the same way. Pain also you can distract it. Now, there's a funny story about the Hindu healers. When somebody came to them with a chronic pain, they'd take a 2x4 and bang them on the body, create a new pain, and that's what Bikram says, pain kills pain. So he gives you pain in all other kinds of parts, and all your previous chronic pain is all gone. And it's just dim memory. So distraction, like I say, is another thing. So now statistics tells us there are about some 50 million chronic pain sufferers in the U.S. Now, this discussion of pain isn't meant to make you suddenly practice medicine, and it's just from a perspective of us as yoga teachers, the kind of things we experience and the way we've learned to handle it, and the way that we know that, benefits people to how they deal with things. And so if you in the future, as teachers and students come to you, don't play doctor. That's always, that's not you especially. You're a yoga teacher, and we're trying to tell you as many things as we know to make you more experienced in at least in theory of what is happening and how to handle and how to react to it. Now that brings us to the subject of what kind of pain a beginner may experience in a Bikram yoga class. Most of it is basically a sensation of stretching, because people tend to describe it as pain because a lot of times they haven't experienced that kind of sensation in the part of the body that they feel it. So it is important to be able to distinguish what is a sensation of stretching and what is really a real pain, Usually if it's stretching, when you stop it, the pain stops as well. If the pain lingers on, then you have to start thinking about what else has been happening, not the moment of the experience of the part of the body that's being stretched. And then another thing as a beginner you may experience is generalized muscle soreness or a little burning in the large muscles of the body. The burning might be a buildup of lactic acid, and when your circulation can keep up with its removal, and that's usually people who come in the beginning classes who are not in very fit condition, so they will be more subject to that kind of a sensation, the lactic acid buildup and things like that. The pain in muscle soreness is basically caused by an immune response of the body. Whenever there's even a minuscule tearing of muscle fibers, just like when you go to the gym and start aggressively lifting weights, you're breaking some muscle fibers and they build up and create a bigger muscle. Well, it's the same process at work. But however, when the body experiences that, of course, it doesn't know that it's happening internally, that there's no external attack going on. But the response is as if there was a bacterial intruder or some, dramatic thing coming into the body, which it has to be protected from. So the body releases very noxious chemicals to destroy these presumed intruders. And they irritate the nerve endings and create pain. And so basically it's just part of the process of changing your muscle fibers, doing things to it, making them more flexible, making them stronger. Manipulation of the body will make those kind of responses. So it's basically the healing process that creates the soreness and the stiffness, because stiffness comes from accumulation of fluids, and any area that body perceives to be injured, it will send all kinds of chemicals to that area, including water or fluid or whatever other fluid, including blood. So it's when the minor tearing of the muscle fibers releases bits of protein, they will attract the water, which then causes the swelling. Now, when you understand that there's this natural process at work, you will be less traumatized by the soreness. And unfortunately, analgesics really do not relieve this kind of muscle soreness. While it does help joint tenderness, but generally, basically, there isn't much you can do. Some people say that it helps to take vitamins like vitamin C, B1, B6, B12, or even sometimes an antihistamine because it deals with an immune response. But personally, I think you just develop a little bit more of a tolerance to things because it is a natural thing, and you will find that it goes away pretty quickly. So just learn to deal with it. Don't be a drama queen. Now, once you've eliminated all the sensations of not being one of unusual stretching or generalized muscle soreness, then you start analyzing the quality of the pain. Now, most commonly, a sharp pain is a muscle spasm, and which is generally created by oxygen deprivation in the affected area. And this kind of pain comes on slowly in a passive muscle. Like waking up in the morning, you have a crick in the neck, it's like this is all night long. You've been laying in an awkward position, pressing on a nerve, and you wake up, and then there you have the spasm then. But if you do it in a working muscle, like when you do in yoga class, and suddenly you're doing a forward contracted bend, and you have a muscle spasm in the abdomen here somewhere in the abdominal muscles, that is a working muscle. Suddenly you've compressed, there's not enough oxygen, not enough support going into that area, and so the muscle will spasm. Or at night also, you'll get this muscle spasm in the calf or in the thigh or something from mineral imbalances. So, there are many ways that the muscle spasm can be created, but it's a transient thing. It comes, it goes, and again, let it go. Now, if there's burning, tingling, numbness, it's most likely a nerve that's being compressed. Now, this kind of nerve compression can occur almost anywhere in the body, but most likely it is somewhere near a vertebra. Now, the tingling in your fingers, tingling and whatever, sometimes you get contractions in the fingers. You suddenly are jammed like that. It probably originates somewhere in your cervical spine, somewhere in your cervical vertebra. And so you will actually, little by little, you're going to start. You have actually, I think, a sheet of paper of this information where the various pathways emerging from the spine go to which parts of the body, which parts of the limbs. And then very often when you have in a distant area in the leg or an arm or wherever, a spasm or tingling or numbing, you can start tracing through that information you have to which vertebra in the spine you have affected and aggravated. So the carpal tunnel syndrome also can be sometimes originating here, but most likely that's a risk that has been overused, and sometimes due to work, people who work in stores, cashiers and computer technicians, and all those people who do this all the time with their wrists develop carpal tunnel, and you'll get lots of those in your yoga classes. And so you have to start dealing with that, and so that you don't aggravate it. When they do the postures, they learn to stretch that area through the posture instead of compressing it and jamming it like some of you are doing habitually in your grips, which I have mentioned in the class, I'm sure you remember. So anyway, now, I must remember this, the nerve glides. Now, if you have sometimes the origination is up here from the cervical spine, and you have down here in the hand, but the nerve may be trapped somewhere alongside the whole length of the arm. So I'm going to show you a very useful way of releasing this by manipulating, having these nerves freed up again. There are three major nerves. There's the median, the radial, and ulnar nerve. And so you do them by extending your arm out to the side and just doing this. You feel it all the way from here to here. Anywhere the nerve is entrapped along from here to here, by doing this, you don't move the fingers. You keep the palm absolutely straight, and you only move the wrist with the arm perfectly straight so it goes there. So this with the thumb up and the palm flat, that's the median nerve. Then you can trace it. You look in your chart and you'll probably find it. Then this is the radial nerve. You put the thumb inside your hand, extend out. Now the thumb is down inside. And again, you do this. Gives the length all the way. Okay. Now the ulnar nerve is really weird. And what you do is you make raccoon eyes. You make circles with your fingers. Then you hook your fingers under the chin. This way. That stretches the ulnar nerve out back alongside here. Okay? That's do it yourself. Don't bother Dr. P. Now, with continuous practice, your body shifts and changes all the time. So the sensations of discomfort and pain also change. So a dull, nagging pain may be due to accumulated chemical wastes which have not been carried away due to impaired circulation. And then that creates nerve irritation, burning, shooting pain, and aching. On rare occasions, a physical injury such as a sprained ligament or a strained muscle, commonly called a pulled muscle, it may happen in class. And it's usually due to incorrect alignment, not following directions for the posture, or using too much force, or bad biomechanical habits. So all of those things can contribute to a little sprain or a strain. A sprain is a partial tearing or overstretching of a ligament. When the fibrous structures that bind the bones together at the joint are affected, the whole joint is sometimes compromised by that. Because ligaments connect bone to bone. You're learning that now in anatomy class. And they are not designed to accommodate stretching. Muscles are designed for stretching. Nerves are amenable to stretching, not ligaments, not tendons, because those structures don't have blood supply within them. So they don't have an easy way of healing, and you really don't want to aggravate them. Now, a ligament, if you try to stretch it more than 4% of its entire length, and 4% of small structures, it's a very small amount. So you should just even think in terms of, back off as much as you can of trying to stretch the connective tissue. Because when you overstretch that, it no longer supports the joint in the proper way. You can also fray it and make it weak, and so that you have a wobbly joint as a result. Now, a strain is an overstretching or injury to muscles, or also tendons sometimes. And just like the ligaments, the tendons are also not amenable to stretching. Sometimes when they have a tendon injury like that, they call it lumbago. When someone comes into you in the yoga class and say they've been diagnosed with a lumbago, you'll know that that's a strain of a tendon or a muscle. Now, tendons connect the bellies of the muscle to the bone, and you're going to be learning all these things with Dr. P. But part of my thing, I'm mentioning it as well. Now, the fibers are similar to the ligaments and do not permit much expansion. They too will overstretch, and they are generally hard to diagnose because soft tissue injury does not show up on an X-ray. So these types of injury generally tend to go away spontaneously. If you're younger, it means in a few days. or not. You know, if you're older, if you're not in good condition, it may last longer. Tendon, and I avoid at all costs tendon and ligament injuries. Now, tendons are tough and fibrous, but they become more susceptible to injury as people age. And that is due to drying out. We all slowly turn into human jerky. So, now, sudden twists or repetitive motion can aggravate them into inflammation. And then it's diagnosed as tendonitis. So it's most frequently seen in middle-aged and older adults. So if you fit that category, be kind to yourselves. Don't, threaten your tendons in any way. And the inflammation then causes pain and tenderness and stiffness, and that's due to the accumulation of fluid, of course. Now, best treatment in tendonitis is resting the affected part. Taking 2 classes a day, very hard to rest, isn't it? So again, prevention goes a long way. You can take anti-inflammatories, also icing, and sometimes applying heat, whichever feels better. And with care, that's the kind of thing, again, will improve in about 10 days. But if you see a doctor, they will probably want to inject steroids in the affected area, and I usually avoid that. When this unfortunate thing happens to your knee, it's known as effusion, or more commonly water on the knee. It's really synovial fluid, because there's no water. There's always all these areas have synovial fluid. The joints are all bathed in them in order to help them move more smoothly. So if the knee is injured or overused, too much fluid collects in the joint, and that results in swelling and pain. Now, among the knee injuries that can create knee effusion is damage to the ligaments, that's overstretching, a dislocated patella, damage to the meniscus, or a byproduct of the joint inflammation due to arthritis. Inflammation pain is caused when the joints or other tissues become swollen and release natural but painful chemicals. Again, part of it is healing. It's the muscles and the nerves that are more responsive or most responsive to stretching. When the muscle is held in a stretched position consistently for a period of time, the muscle fibers grow in length by adding contractile units called sarcomeres. Connective tissue follows and flexibility improves. But you have to work gradually and persistently, with a lot of determination, but carefully, not injuring, not going past your limits. The limits should always be kept in mind for tendons and ligaments. Remember that flexibility is not the product of effort. Being conscious and attentive to the areas, agonist muscles, that's the muscle, the working muscle, that produces the movement. And that allows then the antagonist, the muscle that's the opposing muscle that's stretching, to relax. Everything happens in pairs. One muscle contracts, the opposing muscle relaxes to allow that contraction. It's invariably every single move. There isn't a movement that you do that doesn't happen in that way. So awareness and precision in the regular practice of the 26 postures will allow you to change the body. And some of you do have to change the body. You have to change your habitual posture in order to start really feeling at ease in the postures. Because the definition of asana is to be in a position of comfort and ease. And when you're going in the posture, not really very comfortable, is it? Now, peripheral nerves and their connective tissue ensheathments are sometimes a real problem. It's because of their extreme sensitivity. Now, there's a lot of difference in these various nerves. Their length and the serpentine pathways determine how much additional flexibility one of these you can achieve. The nerve fibers will allow you. And there's, again, difference in individuals. It's not like one size fits all. Some people have, the rubber band people who can fall back and touch the floor in a backward bending, their nerves and their muscles and their connective tissue are very loose. But then there are others who are holding on to everything. Their muscle tone is so great that they won't let anything go. And they're really gripping those nerves with all the protective power that they have, because that's basically what the muscles are trying to do. They're trying to protect the nerves from being injured, because nerves are very sensitive, very vulnerable, and they can also overstretch. Just like, if there isn't enough serpentine nature in a nerve that you're dealing with, then at some point it's going to react very unfavorably. And there'll be numbness and tingling and sensitivity. And all those are warning signals. They're always signals that tell your body before it gets injured. And again, yoga is for smart people. And smart people pay attention, not only what other people around tell them, but what their body tells them. And that's what I want you to learn, to start understanding the body's language. And the warning signals. You take care of what the signal is telling you, and there's no problem. It never happens. So the nervous system also provides physical signals to you when you're going too far in the efforts, like pain, weakness, trembling. Now, trembling is very, very often you get up on the tippy toes and the awkward in the second, and you're a little bit of trembling when your muscles aren't quite strong enough. Don't hold too long, because if you start forcing too much into that, you just might get some, unfavorable result. So that all those signals tell you that muscle that you're working isn't quite ready for that yet. You're trying to get your entire body weight into that. So be patient. There's another yoga class. Another, 6 hours later, you got another one. So you don't have to get it right now. And you can get next week maybe even. So patience. Now, ability to stretch muscles depends on mental relaxation as well, because it helps you to disarm the protective reflexes. I'll talk later about reflexes. They're an interesting phenomenon. Now, emotions and mental states increase the resting tension values of all the musculature. And the greater the tension, the more fatigue, pain, and dysfunction occurs. Mere force will never make the muscle tension relax and the fibers to lengthen. One of the fundamental jobs of muscles is to prevent sudden change. So that's why ballistic stretching or bouncing stretching does not work. You'll notice that in the awkward, I never tell you to bump up and down. That is ballistic stretching by my definition. And I just think that especially for older knees, it's not ideal. When you're young and juicy, you can, drop from the second floor story and not damage your knees. But when you're my age and you start bouncing up and down, well, maybe you have trouble walking after that. So better not. So it's most likely that kind of attempt at stretching will produce rips and tears instead. So refining one's senses and concentrating the mind to work at pace that encourages trust and surrender. Your body, your nervous system has to trust you that you're doing a controlled, proper thing, that you're not threatening your body in any way and exposing it to disaster. So also by just calming your mental turmoil and your the fear that goes with fear, like when you go in a fixed firm, the one thing you have to exhale is fear. Everybody, when you start feeling that stretch in the thighs and the knees, there is a fear reflex at work right away. If you exhale deeply, go, just let go. And boy, everything settles down and you survive and nothing broke. So And that's where if you hang on to that, you have a self-perpetuating cycle of excess tension that you maintain in that part of the body. Convert the agony of stretching to the ecstasy of luxurious release. That brings me back to a story when I was before I actually had discovered yoga, I was in a dance class. And everybody did the stretches, they did splits. And my God, my hips were never meant to be doing splits. And when there was this really, about my age, my size woman who was next to me, and she would just drop into the splits and go, such a luxurious release. But honest to God, I wanted to rip her head off. Sorry, but then I found yoga, and then 20 years later, I could do the splits, and actually was a luxurious release. Well, so state of mind and the force of emotions are often harder to overcome than the physical resistance of muscles. Now, muscle injury is classified by degrees. The first degree strain, also called a muscle pull, it's just a mild tenderness and has full range of motion and generally heals in 3 to 5 days. However, if you've gotten deeper into it, if you've gotten into attachments, like the hamstring attachment here attaching to the sit bone, not so easy. It may take 6 weeks or more. So again, then you have to develop patience. If you're in the habit of pulling your tendons or ligaments, then better be patient. It's going to take a while. Now, second degree strain, the muscle or the tendon has been maybe torn a bit. And so that results in limited range of motion, probably much more painful, and possibly more swelling. And so it takes about 3 weeks or so to heal. Again, all things being equal, age also plays a role in that. The younger you are, the sooner all these things heal. The older you are, the longer it takes. Now, a third degree strain involves a complete rupture of the muscle unit with severely limited motion. And the pain initially is very severe, but may subside. And it's best to immobilize in that case and seek medical help. To my knowledge, we haven't had the third degree strain in a yoga class yet, but I'm just telling you the 3 ways that they measure the severity of these things. You may get first easily enough. You have a bit of overstretch. You may possibly get a second, but that's more likely when you start doing the advanced series. Then you get a little more demand on the body in certain areas. Now, healing time, like I keep saying, is age-related. An injury that heals in 24 hours in a 20-year-old will take about 3 days in a 40-year-old. Not even very old. 40 is nowhere, right? It's not very old. But the body at 35 already starts aging more drastically, and the various arthritic symptoms start manifesting themselves in a 35-year-old body from there on. So practice yoga and prevent all that. Now, when you strain the muscle, the soft tissue cells in the capillaries in the muscle rupture. The capillaries dilate, fluid containing healing cells pours into the wounded area, which creates redness, heat, inflammation, and pain. The blood vessels surrounding the damaged tissue become more permeable, allowing the macrophages, platelets, and lymphocytes, which are the healing agents, to rush through them, clean up the site, and begin the repair process. And blood clots form, which also increases swelling. What to do in the first few hours after you sustain that kind of a strain or sprain will determine how fast you will recover from the event. The key, and the first thing you do, is apply ice. I hope all of you have some ice or some, I'll tell you how to make a plastic bag with the fluid that you can keep for icing. Because icing is the most effective, safest, and cheapest form of treatment. For even mild pulls, you get a sore, something, you come out of class, you're a little bit sore, your knee a little bit twingy, slap some ice on it. Hold it there for about 20 minutes or so, and then, maybe alternate it for a day or so till you no longer have it. But the icing is a very, very effective form of any kind of mild kind of injuries to any part of the body. It can also help with some chronic or overuse injuries like tendinitis, which can flare up after exercise. If you've had tendinitis and it's been kind of dormant, and then you start working 2 classes a day, there may be a flare-up. So the ice first acts as an anesthetic, and that reduces the pain impulses. The pain receptors calm down. And then the cooling also reduces blood flow and muscle spasms and inflammation. All those are good in facilitating, feeling better. Even so, inflammation is part of the healing process. Too much inflammation can impede the healing. That's why you want to have. After you've had the icing, then you can start heat. That brings more blood and again facilitates faster healing. But now remember again, when you put the ice on, and make sure you have some cushioning, some cloth between the ice and the skin. You don't want to create ice burns on your skin. And also, don't hold it on too long. At first, maybe 10 to 20 minutes, and then do it a couple of hours later again. It's like, so you don't hold them for half a day at one time. So just be a little reasonable about things. But if you have pain, that's one way to really quickly deal with that and start feeling more comfortable. So, especially when you have something on your knees, on your elbows, there the nerves are very close to the skin, so make sure you put some padding between the ice and now you can make this your own inexpensive cold pack by filling a 1-gallon heavy-duty Ziploc bag with 2 1/4 cups of water and 3/4 cups of rubbing alcohol. And that you close that and put it in a second bag, just in case the first one was leaking or something. And then put it in the freezer and use it as you need it. If you don't want to do that, get a bag of peas. Do that same thing. Do you have freezers in your refrigerators? Yeah, well, then you all can have your own personal drugstore with your ice thing. Remember the acronym RICE: rest, ice, compression, elevation. That is a mantra that you should remember in order to, treat yourself like you're your own best friend. Instead of telling the pain to shut up, try to be gentle with yourself. Now, the rest reduces the pain and prevents further aggravation of the injury. Compression can be a wrapped towel or an ice bandage. Sometimes you can combine that with ice. At the same time, try to elevate the injured area, if possible, above your heart level. And this will help reduce swelling. And for certain injuries, you can try a gentle ice massage. You take one of those little paper cups, freeze it, and have ice in it, and then use it like a little massaging thing. So most sport doctors now recommend ice for at least 48 hours and then start heat after the swelling has subsided. At that point, the increased blood flow caused by the heat will relax the muscles, preventing muscle spasms, and it will reduce also the joint stiffness. Use moist or dry heat. And there's still, there's all kinds of preferences, one or the other. Find one that works for you best. Now, heat is a wonderful therapy for many kinds of pain: muscular spasms, blockages, skin infections, warts, itches. All of those are helped by drawing the body's defenses to the area. And traditional Chinese medicine actually used moxibustion, which was a pretty extreme way of drawing the body's defenses. Sometimes it leaves. A friend of mine just did it the other day, had something on her shoulder. There was this great big, I said, gee whiz, I mean, did you have the hickey? And no, she had moxibustion, but it was a big one. Anyway, when I say use heat, I mean warm, not hot. Use for about 20 to 30 minutes at a time and do it again 2 to 3 times a day. Do not apply heat to any area where there's loss of sensation, and stop using if the pain and the inflammation gets worse. So remember, ice reduces the inflammation, heat brings more blood to the area, brings more healing agents to the area, but the area has to be ready to receive that. You know, it has to be appropriate at the times that you're doing it. Now, burning kind of pain would generally always indicate nerve injury, and ice will be a much better way of dealing with it. Don't put heat on a nerve injury. For some types of chronic pain, of muscle pains, ice and heat alternating works best. And some people with lower back pain find that ice works, while others scream bloody murder. They only like heat. So we all have our own preferences for it. It depends what the reason for the pain is in the area usually. Some people benefit from contrast therapy, and some people benefit from Epsom salt soaks. If you have a tub, you can put Epsom salts in it. Or the one way of doing is castor oil packs. That's a very old-fashioned remedy. You take cold-pressed castor oil, you saturate a flannel cloth with it, and then put it on the area that's hurt, put over a plastic bag over that, and put a heating pad over it. Where if it's a hip, then just pack 3 layers of it. And then do that as the last thing. You get in bed, you put that on, keep it on for half an hour to an hour. Just don't create a burn. And then go to sleep. Don't walk around anymore. That's especially good for lower back. It's also good for menstrual cramps. So, and it's good for all kinds of various things. My mother had a long list of things that she used it for. She lived 102, so I take her word for it. So, under normal circumstances, absent some accident, the 26 postures that we practice here will not create any nasty injuries. What we are doing here that represents normal range of motion for the body, and the kind of pain that you get is comes from generalized soreness, and that comes from using body parts that have been in sometime in cold storage. In your case, doing 2 classes a day probably creates a little bit of overuse situation. So, but the body is extremely plastic and ultimately responds quite rapidly. In your 3rd week, you should have been over the worst, really. That's usually the first 10 days is when things are pretty dramatic sometimes from doing 2 classes. But by now, you should be okay. And if not, it will happen very probably by the end of this week. To prevent strains and sprains, pay close attention to the alignment of your body. Do not force the posture, and be patient with yourself. There's always another yoga class. You know that. It's guaranteed. And the object is always your body. It's not the posture. The posture is meant to do something good for you, not something bad. So if it feels like it's not doing good right at that moment, feeling good, first of all, evaluate it. Am I in the right alignment? Am I doing as the posture is being described in the dialogue? That is the blueprint. That's the prescription. If you're not, if you've done some modification to allow for your, what I call disabilities, your body has some biomechanical problems, some whatever, there's numerous ways of things that can happen that you try to get around. Instead of facing the obstacle and moving into it gradually, very small incremental segments at a time, you want to go around it, and then you do something, and then it pulls totally in the inappropriate area or engages the inappropriate muscle, where a major muscle should be doing the heavy lifting. You've got the subsidiary muscles who are weak and unable to do it, and they are struggling with all their might, and they're creating pain and possibly an injury. So it's always up to you. You are in charge of your body, and you have to make sure that you're applying these postures in the correct way to the body that you have, to the reality of your body at this time. So the first thing, in order to get the right practice, you sometimes have to change the body. And that's what, in the first stages, that's what needs to happen. Remember, it's called yoga practice. It's not yoga sudden, you take a pill and you're suddenly there in this perfectly wonderful new body. You have to work for it. If by some misfortune you do get a sprain or a strain, follow the course of action that we have discussed. You may also want to use some aspirin. It's an anti-inflammatory, prevents prostaglandin formation, which is what causes pain. And so it's also limits swelling. You take it as food, no more than 6 a day, and that's, of course, if you do not have allergy or bleeding from aspirin. It thins the blood, peaks in 2 hours, declines during the next 6 hours, and science doesn't know how it works. I like it because it is the oldest, most tested analgesic, and it has so many wonderful other things that it helps people with. They now give aspirin for almost anything, including heart disease. It's ridiculous. But there's this little aspirin for 100 or more years working to make humanity's life better. I just learned a very interesting factoid about aspirin. Researchers have discovered that trees and plants produce aspirin when they are under stress. And that's how they diffuse it in the air, communicate with each other that there's some sort of a trauma in nature affecting them. So if it's good enough for them to communicate, I think it's good enough for us too. So most muscle soreness occurs right after strenuous effort. There's also delayed soreness that develops hours or even days after exertion. And it's applicable to yoga because it often follows intense eccentric contractions or stretching. That means when you stretch something that's under load, and in which case in yoga postures there are a lot of them. We continuously are in the floor postures. Anytime we let down out of a posture, we are doing it in an eccentric mode. So there's always that pressure present. So when you're not practiced for a while, you know everything to do. This is the dangerous time. When you have practiced and your practice has been very good, you go away on vacation like I did, and come back a month later, you've been a lazy sloth, you haven't done a thing, but your mind knows exactly how to do it. So first day, you go to it. And wowie zowie, the third day you want to die. So, but then after the third day, it's all gone again. It's so funny, really. The first day, nothing hurts. You go into the deepest thing. You think the shoulder hurt when I did it? No, didn't hurt at all. And then, wow, been hurting for weeks. But anyway, it's better now. So anyway, where are we? So it's again, you don't want to threaten the attachments, the connective tissue, the various attachments, and so that you don't create damage. When you've done it regularly, you have a certain range of motion that you follow, and there's no problem. But when you stop doing it, your atrophy sets in within 24, 48 hours. Suddenly the body goes totally internally, goes to another place, like you never did yoga before. And it's really discouraging sometimes. You think that there should be a pass sometimes for you not to do yoga, but no. Then 2 days maybe, but after that, the body starts getting whingy, starts complaining. Sometimes, it's really weird. I actually hurt when I'm not doing it. So it forces you back into doing it. You just, there's no way out. Once you're there, you commit it. You're stuck, my friends. So anyway, the way I do it now, after a lazy vacation with no yoga, I generally have a very first easy class, back from vacation, And so this, I monitor, I do everything very carefully, so I never threaten anything, and I never have this blowout after that, so I'm just fine. Finally, good sense came to my brain, except this one time. Ugh. Now, do not take pain medications before a class if you have some sort of injury, because it will mask the symptoms and you probably continue injuring yourself, and it will just be, things will go worse, not better. Now, just like acute injuries go in stages, first, second, third, healing also happens in 3 phases. First, there's reaction, which is inflammation, swelling, and pain. Now, repair and regeneration in the second stage, where swelling will provide stability. Now, body's way of splinting an area is to provide swelling or to have a spasm. When those nerves in the neck are threatened and you suddenly have this and you can't move the head. Well, the body's put a splint on it because a nerve, which is in the neck, is usually a critical nerve, a very important, the whole body connection. So the body is trying to splint it, prevent you from damaging it further. And so you have to figure out what it is that's causing it and what you did and how you did. And if you can gently let it stretch it out, like I have a favorite thing, happens to everybody that wake up in the morning. You get on the floor, everybody knows, if anybody knows here what the bridge is. You get on the floor, knees bent, and then you grab your heels and you stretch out the back. And that's very passive kind of stretch, You just open up the area that has been splinted, and the body starts trusting you again and believes that you're not going to damage the nerves that are being involved. So, so the repair happens again with the fibroblasts begin producing new collagen and enzymes, and they degrade the damaged tissue, and the tissue wound starts to contract and produce stiffness. And that all happens internally. But remember, nothing's been cut on the outside. The injury I'm talking about is a muscle tear or a tendons fraying or something happening inside the body. Now, remodeling and maturation, about 3 weeks later, when the collagen has remodeled itself, and usually it's influenced by the mechanical load that the injured area receives. Under load, connective therapeutic, it has to be a therapeutic kind of exercise. You have to really be understanding and knowing what you're doing when you do that. So that's when the collagen fibers start transmitting signals, and that induces changes in the cellular metabolism. And the pressure and tension modifies cell synthesis, and so the tendons and the articular cartilage start remodeling and start returning the area to structural integrity. Now, if you have any scar tissue resulting from that, it will always exhibit 30% less tensile strength. So some of you who've had major kind of surgeries and there's scar tissue, like women who have had hysterectomies or who had C-sections and all that, they have big scar tissue in somewhere in the body. Be aware that the connecting part, the healthy tissue, there'll be always more pull on that area because the scar tissue isn't going to stretch. It's not going to give 1 fraction of an inch. So the adjacent tissue will always be feeling more of a stretch, and so you don't yell at students who had the surgery, even if it's 6 or 10 years ago. There's still that scar tissue issue that you don't want to be, subjecting them to unnecessary pain by making them go in an extreme backward bend where that may be hurting the hell out of their area where they are affected. Now, pulled hamstring takes 3 to 5 days to heal. Do not baby it too long because atrophy sets in very rapidly. Start back slowly, but as soon as possible. So the healing time depends on the blood supply to the area. Muscles are rich in blood supply, and the tear will still take 3 weeks. However, a hamstring attachment injury is a little bit different. That's much more difficult, and because it's a tendon, and so you may be stuck with it dealing for much longer time. So avoid putting too much load on the area. You really have to be very, very conscious and aware when you get one of these pain in the ass things right there where it attaches. Bones are rich in blood supply. Of course, you never break a bone, so that just as you know, ligaments and tendons have poor blood supply or none in some instances, and may take up to 6 weeks. No blood blood supply either to the spinal discs. They need motion. That's what increases diffusion of chemicals in the discs. That's the only thing that does. That's why bed rest for spinal problems is totally the most stupid thing in the world. There'll be no benefit at all. So in order to flush those areas with oxygen and nutrients and to remove the lactic acid buildups, which all cause pain, and you need to move. You cannot lay in bed because the disc problem will continue. Because in order to heal, they will take at least 3 months if you have a disc problem. And some of those things where people have the extrusion of the in the spine from the spinal content pressing on the nerve, the body has a chance to reabsorb it, but it takes time. And again, the manipulation, the movement contributes to the speeding up of that process. Because people say, oh, I've got a herniated disc, so what? Maybe about 3/4 of you in this room have some sort of herniation somewhere in the spine. So what? It's nothing. It's just part of human life. So cartilage has no blood supply, and it's also dependent upon motion to maintain a healthy state. It used to be conventional wisdom that it had no biological ability to heal itself. But nowadays there are all kinds of people who say that there is definitely an ability to do that, whether it's glucosamine or some other sort of things. But anecdotally, there have been a lot of reports of success. People missing knee cartilage sometimes are helped by hyaluronic acid injections in the knee, which is a lubricant, because if the knee has lost its cartilage and you have bone on bone, it's pretty miserable. And to improve the ability for the knee to function, they inject this fluid every 6 months or so to keep the knee going so that you don't have to have a knee replacement. The best thing is to keep doing yoga and prevent all those kind of things from happening. There's one more kind of tissue to consider, and I've talked about it, I think, already, scar tissue. It has no blood supply and will always exert additional stress on the adjacent tissues when stretched. As students and certainly as teachers, you'll be confronted with sciatica pain. It's the most common type of pain generally experienced by out-of-condition people. More frequently, definitely, than fit people. Fit people usually have very few problems of all these kind of things that I'm describing here. The source of the pain may also be a spinal disc abnormality, as well as sometimes an anatomical difference between people. In some people, the sciatic nerve is positioned in a way that the piriformis muscle squeezes the nerve whenever your hip is turned out. The one that I'm telling you not to do in the standing bow when you go like this. And so because the solution is always to proper alignment. You don't do things that threaten these iffy areas that we know in some people really can be a problem. So the more precisely you're aligned in the standing bow, without the knee turning out, the less likely you're going to be experiencing sciatic problems. You'll notice that most of the time people who come and complain about it, the first thing you do is watch them how they do the standing bow. And without a doubt, there's going to be a huge turnout. Knee will be going to the other wall practically, and no stretching ability at all in the front. So they will definitely be squeezing the sciatic nerve, and that's where the pain really gets miserable. And you have to understand that when you have a rotational joint, you have to allow it to rotate. When you have a hinge joint like the knee, you never let it rotate. This is absolutely important to distinguish between the nature of the joints. You know, the shoulder joints can rotate, the hip joints can rotate, but not ever the knee. So be absolutely committed to that too, because whatever you do, you always want to protect the knees. They go bad, life is really miserable in both upper and lower body. So watch your alignment, keep stretching the nerve, and keep improving the overall health of the lower back and legs. Again, use your buttocks so that you don't overload the hamstrings so that they become super tight. Have the butt do its work. That's why those muscles are big and juicy. So use them. So now icing will give some relief to the sciatic problem, but resting, forget it, doesn't do much of anything. So people benefit if you know what the pigeon prep poses, where you lay down, bend one leg in front of you, extend the other leg behind you, and then sit up like this. And it's a very nice thing for releasing the pressure on the sciatic nerve. Now, Dr. P also has some special stretches. Whenever he suggests something for you, pay attention and definitely use that. Because, you know, we're working together and trying to give you tools that you can be self-healing, and that's what yoga is meant to provide, you know. So most people, the first thing they come into yoga room, they will start talking about their slip discs. That is the big bugaboo. First of all, there's no such thing. A disc does not slip. It may rupture, it may bulge, or it may herniate. It does not slip. Now, intervertebral discs are cylindrical pads of fibrocartilage containing a pulpy jelly-like mass, which is called the nucleus pulposus, and it's all encircled in an annulus fibrosus. The disc is constructed like an automobile tire. Like a tire, it's under high internal pressure. The pressure is from water, not from air. And it acts like a shock absorber, and it gives flexibility to the spine. But like a tire, it can blow out. Now, a blowout sounds very, very dramatic. The reality is much less so. The nucleus extrusion is generally quite tiny, and unless it presses directly on a nerve, it's really no big deal. Like I said, a great many of you may have it somewhere. If we took an MRI scan of your bodies, of your spines, and you would have no idea that you have it. So, and in most cases, the body simply reabsorbs it. Now, if a person has been injured in some sort of accident that shredded the annulus, well, then maybe more pulp may have extruded, and the problem then is more severe. And but yoga practice, in all instances, will help, and medical methodology of rest and surgery will not. Now, before finding a yoga class, various people try various treatments that are available for chronic pain. There's, of course, massage, there's physical therapy, there's ultrasound, there's transcutaneous electric nerve stimulation, or TENS in short. All of these can help because what they do is they carry away cellular waste, they relax muscles, and they decrease nerve excitability. Now, acupuncture can also be sometimes helpful. Now, they have done some recent MRI studies of acupuncture showing what happens where the reaction is actually when you stick the needles in. Well, the needles apparently stop the blood flow to the brain. So the brain quiets down, and so it starts releasing endorphins, which are painkillers, body's morphine. So it actually works in that way. And actually what helped my shoulder was my blind Korean. He did a wonderful job. He was actually, it's so funny when someone says, you have a blind acupuncturist? Well, when he applied for his license, the state of California licensed him and gives him a test. He was #1 out of a group of like 400. So, and every time, it hasn't been that many times, but any time I've needed some little help with pain that I haven't been able to handle, he puts them in right away. One treatment, and it's done. And that's actually how it should be. With acupuncturists, also with people, chiropractors. A chiropractor who has you come 3 times a week for the rest of your life, forget it, it's not going to work. If it works the first time. It releases the pressure on the area that's giving you grief by rearranging the biomechanics of your body. And then it works, and it definitely has its place. All these things will help some people sometime, but all of yoga people can help themselves all the time. You just have to be attentive to what you're doing. Now, that's why I'm saying that intelligent yoga program like the 26 postures is the most beneficial and lasting treatment for all types of skeletal and muscular pain, no matter how long you have been plagued by it. The cause of chronic pain is seldom structural abnormality. Recent reports have been talking about studies where people with ruptured discs that can be clearly seen on an MRI or a CAT scan have absolutely no pain or symptoms whatsoever, while others suffer agonizing back pain and agony. Yet there are no observable abnormalities in their spines. Now, what's happening? Now, this brings to a very important subject. Psychophysiology, basically. There's a doctor who has made a study of it, Dr. John Sano. I discovered him about some 30 years ago. And he's given a name to this kind of a back pain syndrome, which has no diagnosable structural cause. He calls it tension myositis syndrome, or TMS for short. Tension myositis, that's muscle inflammation syndrome. If you're interested in learning more about this subject, and I strongly suggest that you would, because it's usually the cause of a large percentage of people's backaches, Dr. Sarno has written some very informative books regarding the TMS, which describes the effect of the mind and your emotions on the postural muscles and the associated nerves. One of them is, the book is called Mind Over Back Pain. Another one is Healing Back Pain. And the third one I know is Mind Body Prescription. So his name is Sarno, Dr. Sarno. Now, Dr. Sarno explains how a man's whole body records his emotional thinking. The cells are constantly eavesdropping on your thoughts and feelings. And yet we want to believe that all pain that occurs there is due to some injury or some physical event. Not so. The autonomic nervous system controls circulation as well as numerous other involuntary physiological functions. Blood is pumped through from the heart through the arteries, which then divide and subdivide into progressively smaller units until, at the tissue level, blood is carried to all parts of the body through very small blood vessels called arterioles. Now, emotional tension can induce alteration in the local circulation, resulting in blood deprivation or ischemia. Tension causes the arterioles to partially close, thus slowing circulation and depriving the tissues involved of normal blood supply. This blood deprivation is not enough to damage the muscles and the nerves, except in the most extreme cases. conditions, but not due to yoga, but like if you have earthquake and you have a huge block of cement drop on you and stop circulation, you probably will lose a leg. But when you stop the circulation in your life, through your mental tension, you can't create that much to lose a leg from it. But it is excruciatingly painful. So the pain is created first by oxygen deprivation to the muscle causing it to spasm, and then second from a buildup of chemical waste products, which are ordinarily carried away by the blood and eliminated. But now they're sitting there burning the nerves. It's the neck and the shoulders, as well as the lower back, and especially the blue jean pockets here. This is the area where you have like trigger points for this. And it's not due to mechanical problems. It is all due to your feelings. So you have to start accepting and understanding that it's your personality and your internalized stress that governs the level of pain and anxiety that you always, goes with it. So that is what creates this pain syndrome, and not some sort of injury. It's self-induced injury. So people develop or deposit chronic tension over their entire bodies, and very often are completely unable to change it. They really become a victim of their own emotional life. And when the reduced circulation reduces the oxygen and the nerves to areas such like sciatica. That's a very important reason why you get sometimes sciatica pain. That cannot be explained by your body functioning. So it will affect the sciatica as well as any other peripheral nerves. There can be pain, feelings of numbness, pins and needles, even a weakness in the strength of the muscle. When that happens, it means that some of the nerve fibers bringing the messages from the brain have been already damaged. Nerves bring messages from the brain to all parts of the body. When the nerve is irritated or damaged, pain will be felt in that part of the body that the nerve is going to, such as an arm or a leg. The mechanism for TMS is essentially the same as it is for producing tension: headaches, heartburn, spastic colon, colitis, all kinds of other tension-related ailments. It's all the same principle at work. The 26 postures are the most efficient oxygen delivery system that attacks TMS on two fronts: by correcting incorrect body mechanics, thereby reducing chronic muscular tension and increasing circulatory efficiency to the parts of the body, and by lowering the overall stress level of the body-mind, which is always at work for us. Moist heat can alleviate some of the TMS pain. Cold does not help, unfortunately. Any relief you get is usually temporary. The pain keeps returning as long as the stress continues and is present. The degree of muscular tension will continue and will increase and will determine your pain level. Mental stress has a cumulative effect on the body because social constraints do not allow us to discharge a lot of our negative emotions, and as a consequence, they find repository in various parts of our body and manifest themselves as muscular tension. Each thought and emotion generates a metabolic event in our system. The body generates hormones in response to a situation that it perceives to be danger. If no physical action follows to discharge these hormones, the strong muscular action that they precipitated remains in the tissues, because the fight and flight syndrome manifests itself in either starting punching someone out or running like hell When you can do either one of those, you won't accumulate this residue and tension in your muscles. But then you will probably wind up in jail if you punch someone out. So stress will be even bigger. In some individuals, TMS occurs during sleep as well, because stressful, unconscious mental activity never ceases. It's the source of the pain. If the source of the pain was mechanical, and there was some sort of malfunction, and not the TMS, the body would be at rest. It wouldn't hurt. Night pain is generally a confirmation of TMS. The more perfectionist, the more compulsive the personality, the more likely that one is to experience this TMS syndrome. One of the first steps to recovery is first recognizing this factor. The pain is personality driven. Realizing it alleviates a lot of fear, a lot of visions regarding wheelchairs and things that maybe as as a result of this terrible pain that for some people go on for years. It's really some of the stories I hear from people who've been really incapacitated, literally crippled by this pain. They take a week's worth, not even, but sometimes even a couple of classes, and the pain is suddenly gone. And they think we're miracle workers. Okay. So yoga, meditation, and perhaps even a psychiatrist are all modes of treatment. Stay away from orthopedic surgeons. For that thing, orthopedic surgeons are not. For some things, they are wonderful. But not for TMS. That will cripple you. Okay, we come to pretty much to the end. Now, doing the 26 postures entrains the organism to a coherent field of body, mind, breath, and energy. And what I think is a great thing for us now, we've been sitting here for quite a while, and I think it would be time to do a little bit of sound therapy, because it really does vibrational healing, mobilizes a lot of cells by taking advantage of the body's pharmacy. The body probably has the most wonderful pharmacy of anywhere in the world that you can find. We can create all sorts of chemicals and all kinds of reactions. And doing a little bit of, like we usually Om, but I have what I call a vowel therapy. What you do is you find each sound range has an impact on individual bodies. Some people respond better to an O sound, some to an E sound. So it's vowels that we're going to be chanting. And what you want to do is observe how your body reacts to it. And if you can discern a difference between the vowels, the different vowels that you're doing, if you happen to have a discomfort somewhere in the body, focus on that area. Energy follows thought. So train your thought on the area that you have this discomfort, and just keep seeing if you get some sort of a understanding of how your body reacts to the different sounds. We're just going to do the vowels, A, I, E, O, U. So let's just sit comfortably, free up your diaphragm area so you can take a really deep breath, so you can hold it so you're not out of breath in a couple of seconds. Because if you do it from the chest, you won't go very far. So relax your abdomen, inhale, expand it, hold it, and then we'll start the sound. We'll start with the sound A, ah, okay? Ready? Everybody take deep breath. Keep going. Good. Okay. Next one, let's tie an I. I. Ready? Deep breath first. This side is winning. And then let's go to an E. E. Ready? They are definitely full of hot air. And then let's say ooh, you. Okay, ready? That we'll finish with O. And the last one, and of course that is the one that we do for home. And we'll finish with that. Ready? Nice big inhalation. Can finish with the Om at the end. Okay, so that, anybody felt any reaction, any connection to one of the letters more than the others? Yeah, I know, I prefer O myself. But we all have a different biology, so, you know, that's... And I think just about everybody needs to go to the bathroom now, don't you think? We've been, what, an hour and a half. When we come back, we'll continue. Have you had any, well, it doesn't matter, the be or not. Okay, so let's have a break, and let's come back in 15 minutes. So 10 minutes after 2. Have been different up to this stage, and so all depends what you have accumulated. So emotional release can be a very powerful healer. Yoga and meditation and massage and also acupuncture can sometimes trigger it. So it manifests itself through sudden waves of emotions. It can be anger, can be sadness, can be shame. It can also be happiness, can be giggles and laughter. Now, the results, again, the manifestations, like I say, instead of giggles and laughter, it can be crying, it can be shaking, and it can be also a sense of physical release. Pressure in the body being released. It's like, oh my God, thank God it's gone, kind of a feeling. if you can recognize. Sometimes there's no recognition of mental recognition at all. It's purely emotional, experiential kind of thing. So when it happens, breathe deeply and become an observer of whatever the phenomenon is. Stress is usually stored in various parts of the body, and some are more prevalent than others. But anyway, it's wherever it's stored, it's also recorded in the structures of the brain that control those particular body parts. So it's never just body, it's always body and brain, one end connected to the other. Now, yoga practice, regular practice, intense practice, produces heart and brain resonance. And that creates effect in the sensory motor cortex. So that leads to the awakening of Kundalini energy and the consequent release of stress. Some of the physiological manifestations might be uncomfortable and unpleasant, even painful. The one that happened to me was an extremely painful shaking in the thighs. You know, it was like they were jerking for like 24 hours. It was crazy. But anyway, you survive everything. Got some advice about it, and I was okay. But a lot of people, fortunately, also can experience it as extremely pleasurable, almost like a spinal orgasm. Yes, it is. It's pleasure and bliss, really. And but you know, we're all different. So the chakric, where the chakric and the nervous systems interface with each other, it's through the nerve plexus and through the endocrine system. Now this leads to establishment of a new circuitry. When you have this release, there's a new circuitry that is created in the hardwiring of the brain, which then creates a different way of processing information and energy. Body-brain becomes more efficient in handling stress. Stem cell research has established that the brain is capable of making new nerve cells, and it's stimulated to do so by certain kinds of physical exercise. And obviously yoga is one of them. To learn more about the subject, I can refer to whatever Dr. Itzhak Benton has written. Also, Dr. Richard Gerber, he's author of Vibrational Medicine. And what you have to ultimately learn more is about the chakras. I'm not going to go into it. I don't know. Sometimes Bikram has someone come and talk about it. I don't know if it's happening this time. So whatever will happen, will happen. And the various chakras, the coccygeal chakra down here has the reproductive organ governance. The sacral chakra is digestive organs. The solar plexus governs adrenals. The heart is the thymus gland. The throat is the cervical spine, the medulla oblongata, and the thyroid gland. The forehead, the third eye, is the hypothalamus and the pituitary gland. The cerebral cortex, the seventh, is the central nervous system and the pineal gland. All those are the system that governs the energy, the Kundalini energy that is actually the source of this various manifestations. And I know that there are various yogas who say they awaken this. It doesn't need any special yoga. It just needs to clear some of the stress from the brain-body channels. And like I say, the intensity of the practice that we do here is definitely stimulates that. So enjoy when it happens. Don't get scared. If you get unpleasant physical symptoms, do some repetitive motion, swim, run around the block. Do something that is repetitive motion, which will discharge some of this concentration, the intensity that is happening. Maybe really there's lots more to your human being than what we are taught or understand, even that science understands up to this point. So it's just one of the little smidgens of manifestation that we experience when we do this. And it's just like you get a peek at what is out, it's still there for you to learn, to know, which may or may not happen in the future. If you're interested, you'll be looking into it. If you're not, just enjoy and move on. You don't need it. Life will still be good. Precision of intents and reflexes. I think I better address that first. Biology is destiny. You're stuck in the body that you were born in. You're either an endomorph, which is soft and round, ectomorph, tall, lean, or a mesomorph, that's muscular and athletic. You're also at the mercy of your reflexes. It's habitual patterns of dealing with them that you can control and change when it's necessary. Because the 26 postures are regularly repeated, they exert a powerful training effect and create engrams and memories of how a particular muscular activity felt. That is why there has to be precision of intent in the execution of the posture. The description of the intent of the posture is contained in the dialogue. And you're learning it now. And I hope that you're not learning the words, but you're also understanding how it applies to your body. Often as a beginner, your body cannot do the posture, cannot achieve anywhere perfectly as it's described. But your mind has to acquire a clear picture of how the posture should be that you're trying to perform. What is the end result for your body? If you get 10% of the posture right, you're on the way to incrementally and gradually achieve the correct form. In executing the various yoga postures, one has to learn to either cooperate with or to disarm the protective stretch reflexes of the body. Reflexes serve to preserve and to prevent your body from being damaged, as you continuously have to navigate in the sea of gravity, because the gravitational forces continuously are trying to pull you to the ground. Hi, I just realized the dreadlocks. Just like fight and flight impulse, the stretch reflexes are controlled by the nervous system. We are helped in our endeavor not to fall on our faces by proprioception. Proprioception is developed around the framework of the body by the muscles and by the nerves. Once you have a habitual posture, the body will struggle with the help of the various reflexes to maintain it, even if it's completely distorted. People who have had some injuries, maybe early childhood injuries, who have walked in a strange way, one hip up or, doing that. When they get operations and they're corrected, they have a very hard time to stand up straight and deal with this new body. Now, that's pretty extreme, but some of you have exactly the same problems and not as an intense way. That your posture, the way that you move every day for however many years you've lived, and now, in order to get the posture right, and I noticed that like in breathing, when you do this breathing here, a lot of you in the beginning, you're better now, but your joints were totally misaligned as far as the gravitational forces are concerned. Vertical loading is off. It's also off in some of the other standing poses. And little by little, when you start becoming aware of it, you're starting to be able to correct that as well. Okay, now getting to what we talk about when we talk about reflexes. The knee jerk is an example of a myotactic reflex. When the patellar tendon is hit with a mallet, like you go to the doctor and he does this thing with his little thing on the knee, the thigh muscles contract in resistance. Now, if the same tendon is compressed gradually, slowly, with the same mallet, there will be no jerk. It will just, give in however far you want to press, that's going to be it. Now, as yoga students, and you should really find that instructive, only a slow, gradual stretch will increase the range of motion. A hard, sudden pull, bouncing, jerking will create a strong resistance. Muscles are hardwired to resist strong, sudden stretching. Conversely, a mild stretch will not do it either. Best method is to slowly reach the edge of your present performance envelope and then holding it long enough to disarm the stretch reflex. And then with an exhalation, you can go deeper and all the way into a stretch, however far your physiology will allow it. And gradually you will start retraining the reflex, so you start permanently altering the connective tissue so it will not resist you every time you do it. Some yogis call it working the edges, to find what your present performance envelope is and then gradually expanding it as you go. There's another very powerful reflex to deal with. It's the flexional tonic reflex, sometimes also called postural reflex. Whereas the myotactic reflex deals with individual muscles, the postural reflex acts in protective manner on your entire body. It's a spinal reflex designed for self-preservation. It's driven by the sympathetic nervous system. That's the fight and flight system. It always wants to be ready to defend where you are, whatever your posture is. This reflex is designed to protect the vulnerable organs in front of the body, the heart, the stomach, the throat. The response to a body that's attacked is to roll in a fetal position, knees to the chest, forehead to the knees, and the reflexes are developed in utero because that's how you spend 9 months, the forehead to the knees. Babies born prematurely miss this neurological development. As an adult, they lack a strong postural reflex and tend to lumbar hyperextension and also pain, unfortunately. People with strong flexional reflex have a tighter, stronger frontal musculature, and they have more resistance to backward bending. Imbalance in either direction may lead to pain, as imbalance generally does. So it's wisely to work in the yoga postures to correct whichever predominance you have. Whenever you have one or the other, you try to improve the opposite side. This reflex is always activated by fear, grief, and emotional pain. It's also why many people feel vulnerable in a backward bend. It's because you're exposing your heart to the hostile world and unknown perils. The good news is that it can be retrained gradually. In general, the sympathetic nervous system will dominate in all yoga poses where the head and the eyes are in a backward position. This is due to the cervical flexional reflex. Position of the head has a great deal of influence over yoga postures. Tilting the head back will help in all backward bending poses, like half moon, camel, bow. The yoga poses that are done passively with the chin tucked into the sternal notch, like this, and the eyes turned inward, elicit a parasympathetic nervous system, leading to a relaxation response. So again, your body has a great deal of control over from which nervous system you're going to be operating. So the more you are stuck in the sympathetic mode, the more probably stress you're creating, the more parasympathetic mode, the more relaxation. Now the reason for that is that the ocular vagal reflex comes into play when you have this compression. It has heart-slowing action, especially when the weight of the head rests on the forehead. And you may have noticed that in many yoga poses, the forehead is either on the floor or on the knee. From Western medicine perspective, the chin in the sternal notch creates pressurization in the baroreceptors of the carotid sinuses. It's activated in most inverted poses as the body tries to regain homeostasis. That's by lowering heart rate and blood pressure and energizing the parasympathetic and sympathetic nervous system. This reflex is also activated by pressure on the orbits of the eyes. That's why children rub their eyes when they're sleepy, when they want to go to pose, and so they have a relaxation effect. This makes me think, of course, of the Muslim call to prayers 5 times a day, where you place the forehead on the ground in prayer. Muhammad was probably very familiar with yoga and the physiological release of the stress that comes from this position. So I hope this information gives you a better understanding of why some people feel extremely frightened and backward bends, but they're also very energizing. Because all this physiology, reflexology at work creates some of these fears in people. All you can do, fear and anxiety manifests itself at the level of solar plexus and the kidneys. The breath becomes shallow, and when in a fearful state, the muscles and organs of the body-mind contract. The postural reflex is hard at work, and physiologically there's a rise in energy levels and stress chemicals. Sympathetic nervous system dominates, creating increased heart rate, respiration, and increased blood flow to the muscles. Tipping the head back creates in some people a feeling like they are leaving their body. All these problems can be mediated by breath. When you consciously let go of the fear, of the reluctance to go into the posture, you engage the parasympathetic nervous system and start retraining the body's reflexes. Key to the overcoming to the various reflexes, re-education, do the stretches slowly, hold, allowing the resetting of the muscle spindles, trigger points. So you prevent the reflex from firing. All exercise programs have certain basic concepts in common: form, sequence, and pace. In practicing the 26 Bikram yoga postures, form comes first in importance. However, the sequence is also very important. Each posture prepares the body for the next by creating biochemical activities which facilitate the execution of them. The precision of alignment helps one deal with and take advantage of the various reflexes. One of the basic dictums of Bikram yoga is the object is the body, not the posture. Sometimes in order to get the posture, you have to eliminate blockages and prevent you from doing the posture correctly. Patience, perseverance is the only way to do it. So that's so much for reflexes. And I really hope you pay attention to it, because a lot of postures can be achieved. The thing is that when the mind knows something, but the body does not experience it, the knowledge really will not become understanding. So you have to really learn to apply those words that you're learning in the dialogue to your own bodies. You absolutely will not be good teachers without that. And I hope to God you all are very good teachers, because the world really needs yoga in the worst way. Now, I can keep talking. And my next subject is musculoskeletal dysfunction and pain. And that's quite a bit there. Or the other option is we can do some postures, like we can do triangle. I know there's a pent-up desire for triangle. I can feel it. I feel the waves. So I will take my chair here, and you guys, and make sure that you have the right clothes, that you don't have tight clothes on. And because I will want only come the ones who have this definitely a problem thing. Don't just come here to demonstrate your fantastic triangle. This is supposed to be corrective action. You're welcome. Have a great evening. Enjoy Dr. P.